It probably goes back now about 12 years, where we were starting to look at transition. Obviously that was something that didn't happen in the NHS at that time, and we had young people who were taking up models such as the ILF, and we certainly had families where direct payments were part of the care. And the early discussions were about, could we do training, clinical training in those packages, and in some of them we did. There's also always been an issue looking at the continuing care side of it, that a young person who maybe has a shared package of care, where half comes through a direct payment and half comes through health, maybe within directly provisioned care, when they've got to 18, the personal budget side has disappeared because they've become fully funded by NHS continuing care. And for some of those families that was really quite distressing, because that model worked really well for them, and training and support coming from us and the provision coming from this direct payment. And we ended up with some really convoluted routes of trying for these staff to then go and be employed by an agency, but then for the family to still use them, which made no sense to anybody, but was the only way we could actually maintain the sort of flexibility that they'd got used to. So when personal budgets came along, that was something we were really interested in, primarily initially around transition, and that's where we've initially started to look at it. So I think, to me, risk is something we look at afterwards, once we know what we want to achieve. So in a personal budget, that's very much about the young person's outcome, or the child and family's outcomes, and what they want to achieve. And then risk assessment really is a way of looking at how can we do that safely. But what I would never want it to be is a reason not to do something. So I hope our team's approach is, that's a challenge, we'll find a way to do it, which is what risk assessment is all about. So risk can come from a number of different ways. It can come from equipment, it can come from training, it can come from an environment, and all of those things are possible to solve, and some of them very easily, but it's just identifying the risk is there and then putting in those controls. But I think even the word controls makes you start to think, no, you can't do it, but a control should be just something to make it safer. So for example, it might be an extra pair of hands in a certain situation makes that situation safe. It could be very easy to achieve. It might be a friend, it might not even need to be a trained pair of hands, just somebody else to be around, maybe to call an ambulance, maybe to pass something. So it's about being creative, and it's about finding solutions, not blockers. A classic example of risk to make an achievement. Swimming is a classic thing that I think for a long time I didn't really understand how significant it was to children and families. But I think, as some families have recently discussed with me through some research I've been doing, they see it as a milestone of childhood, and therefore it's really important to achieve. So take a child on a ventilator who has very limited mobility, put them in water and suddenly they feel much freer. But you've got a piece of technology which is electrical, there's a risk of drowning, there's all sorts of risks that are connected to that. However, you can control those risks by the number of people who are in the pool, about thinking about all the steps, about making sure that that's the only young person in the pool, and having a very detailed, specific assessment to enable it. And that's something that we've done, and a number of children's hospices have been particularly good at doing, because they're recognising how important this activity is, and then actually acknowledging that you might need to put quite a lot of resource in to achieve that, but it's such an important outcome to that child and family that you need to do that. And just starting with that principle, there is a way to do this, so let's find it. I think the process of delegation is all about, it's late on, so we start off with a process where we're trying to work out, we're trying to find out more about the child, the family, what they want to achieve, the reason we're putting this care package in, what the outcomes they want to achieve. Then you start to think about how can you meet those outcomes, and what do we need to put in place to meet it. So as we've talked about risk, that's an important part of it. Then you start to think about, well, who's going to do Who's going to do that? And I think you need to understand again from child and family's perspective about who do they want to do that. So maybe if it's a task that takes place in a school or home environment, do they want somebody who's in the school staff? Do they want an agency? Do they want an NHS provider to provide it? Or do they want to employ their own member of staff to do it? If we're talking, we then need to look at what the issues are for that child. And then through the risk assessment and care planning process, we need to identify whether it's safe to delegate those to a non-registered carer. And the way I tend to look at dividing the two is that if it's a task where there's lots of judgments that need to be made, that different things can happen and you have to react to those things as they happen, or the child has a number of conditions that interrelate, so you've got to make clinical decisions, that's about nursing. If it's something that you can clearly put in a protocol, for example, a tracheostomy, if this happens you do this, if this happens you do this, and if this happens you do that, a sort of escalation tree, then that's something that you can delegate. So it is that stability and that ability to clearly list and protocolise, well, that's not a proper word, but it describes it, about how you do something. So if you can clearly write it down, these are the steps that you would escalate if this happened, then that's something you can safely delegate. If it's not, then you need to think about other ways of meeting that need. So that identifies that this is something we can delegate, and then we need to go through all the steps of undergoing safe delegation, so depending on who it is that's doing that.